Dr. Aina. I would like to inquire, my daughter is 4 years old, but she doesn't pronounce words properly, although we try to repeat and teach her.
Okay, so what are the sounds that you've noticed that she's not pronouncing?
She still baby talks.
Can you give an example?
Example, okay, there's this character, Harry the Bunny, but she goes like Perry the Bunny.
Okay.
Like H and P.
Okay, so by the age of 5, they should have all of their sounds, and by the age of 3, like what I explained earlier, they should have those early sounds, yeah? Like the P, B, M, all those kind of early sounds should be established by that time. Well, with speech, we have two different problems, either articulation. Articulation just means that they can't produce certain sounds. But we also have phonology, which means that you're using, they might be able to make the sound, but they're using it at different, the wrong times and all that. So we do need to assess. I can't tell you what problems she's got, because I need to assess and see what are the sounds that she's not producing and what kind of errors she's making. Yeah?
So the best is to take her to a pediatrician?
That one, if it's just the speech, I think you can take her to a speech therapist, because speech difficulties is actually quite easy to work with compared to some of the other language ones. Yeah.
So may I know where are you based?
I'm in PJ, SpeechHelp.
I see.
Yeah.
Okay.
You can look us up on the website. I didn't bring any handouts today, which I should have, but for now you can just look us up on the website.
All right. Thank you, Dr. Aina.
You're welcome.
Hi, morning.
Hi, morning.
I have a son. He's
Okay.
going to be 3 years old.
Okay.
But he had an issue with echolalia, something like.
Oh, echolalia. Yeah, repeating the same thing. Yeah.
So before I don't really notice it, but when he went to the daycare, actually the teachers give it rise of concern because he keep on repeating everyone's word.
Okay.
So it's like if I'm asking him, they're asking him, how are you? He was like, how are you? He was like not answering and just like repeating every single thing.
Okay. So echolalia is actually an atypical development. So is he meeting all his other milestones?
Some of it is just that because when I'm talking to him, sometimes it seems okay, and he's like a lot of bubbling, and then those kind of thing, whatever he's learning in school or from us, he was like keep on like singing or repeating the words. But there are times when I ask him, he will answer some, but there are times as well he keep on like just go on repeating.
Okay, there are several reasons why children might repeat the same things. Number one, they might not be understanding what you're asking them. So let's say if you ask them a question, they might repeat your question because they might not understand what you're saying. And then number two, it could be other atypical development. So that's why you have to track your child's development. Does he provide good eye contact? What kind of sentences is he making at 3 years old? So you've got to look at it as a whole, because some of these features may indicate some underlying issues, such as autism and some of the other things.
Actually, that's exactly the concern because the principal keep on like saying that he has like showing a bit of autistic symptom.
Okay.
And that because one of it because echolalia and he don't really respond to everyone. So I'm not sure whether it's something to do with the daycare itself or some the environment, or it's something to do with the whole. So I can't really fully assess all, but in the case of how I need to overcome in the short term, then that will be very helpful.
Okay, I think the first thing you need to do is actually take him to a developmental pediatrician. A developmental pediatrician can do a thorough assessment of everything, not just his language skills, but also all the other stuff like physically and his motor skills and all that. And then we'll be able to point you to the right diagnosis. But usually when there's echolalia and not understanding and all that, then we do recommend a full assessment of the child. And you can still use some of the strategies that's been mentioned, just to see how he responds to them. And usually environment does play a part in terms of your child's development. But then in terms of the echolalia, I don't think daycare would have caused the echolalic behavior. Yeah.
Hello, hi, morning, doctor. I have a son, he's 2.5 years old. From what I've seen, right, I think imitation of speech is one of the areas which is quite important for kids.
Yes.
What I've noticed is that my son doesn't like to imitate. I see that in my sister-in-law's son. Whenever they ask him to say something or they say something and to imitate, the pronunciation may not be right, but it's there. Whereas for my son, when I ask him to repeat, it's like he's not bothered. I'm not sure whether he can't pronounce it and he's not bothered, or he's just not bothered listening to adults. So his vocabulary is very limited at 2.5. He prefers making sound effects, like when he'll call cars a room because that's how it sounds like, and he wouldn't say the word car. So every time I say car, he said I said car. So that goes on and on. That's the problem I'm facing.
Okay, it sounds like there could be a little bit of a delay since he's 2.5 and he's got limited vocabulary and he's still at that sound level, yeah? So usually the imitation level and the sound level is sort of at the, develops around the same time. So I think maybe you do need to encourage him to just model it. Maybe don't put so much stress on him to imitate the sounds, don't say this, say that, like just model it for him. Because another thing, we don't want to overdo the whole like command, asking too many questions, getting them to do too many things. Because even we as adults, we get a bit fed up sometimes if people keep asking us to do something, right? So it's the same thing with kids. But at 2.5, and if he's got that limited type of vocabulary and from the sounds of it, like just only making sounds and not really imitating action, then there could potentially be some delay. And you'll find that a lot of boys tend to develop their communication a bit slower than girls, verbally anyway. Yeah.
So the right thing is to get him assessed, is that the case?
Well, yes. I think 2.5 should be, the earlier the better, right? So 2.5, you should definitely do something about it if he's still not meeting those milestones.
Thank you.
You're welcome.
Assalamualaikum. Thank you for coming and giving a lovely talk. My name is Puzi. We are an NGO for the development of children.
Okay.
Usually we focus on the underprivileged. But I'm asking a question for one of our volunteers. She has a 4-year-old girl. So what we notice that she doesn't reach all the milestones, doesn't respond, doesn't talk at all. So clearly we would like the parents to see the speech therapist, but the problem is the acceptance from the parents. The parents think there's nothing wrong, it's just delay. So how do we encourage? And because intervention is key. So we would like them to see a speech therapist. If it is just delayed, that's fine. But if we can do something right now, that's better, because she doesn't respond, she doesn't have eye contact, she doesn't socialize, and she's 4.
Well, I guess that's why this type of events are so important.
I did send the link. I did send the link to the parents, and I don't see them here. They're not here.
Well, maybe you could suggest, maybe you could personally send, there's a lot of information online as well. So maybe you could get them, maybe send some links for them, just to make them more aware. Or maybe you can do something at your center.
We don't have a center because we go to the orphanage.
Oh.
We go to the orphanage.
Well, maybe Star will need to do more of these sessions. Yeah, well, that's a problem actually here because we're still sort of developing this whole idea that rehabilitation is just as important as going to the doctors when you're sick. You see, this is something that even I struggle with to get people to be more aware that this type of developmental things are so important. Yeah, even in terms of developmental pediatrician, we are lacking in that department. You know, we only have a handful of qualified developmental pediatricians out there, and they're so full. You know, like it's hard to get an appointment with them. So I guess all of us will have to collectively make, distribute this information to as many people as possible.
Thank you.